prescribed by the physician to prevent constipation, because they have been given this low dose opiate just to alleviate the symptoms, because we know that having COVID or being COVID positive, they are experiencing dyspnea. So they are having this difficulty of breathing, and in providing supportive care and supplemental oxygen, if it is not that effective, so the primary doctor will prescribe a low dose opiate. So the hydrocodone here is very famous as well, especially for the elderly. So to discuss with you about the best practices in Michigan against COVID-19, this is this is excuse me, this is pertaining to us frontliners or healthcare workers. So they impose these employee guidelines if you are exposed to a positive patient. So what if you are exposed to a positive patient? So from the Department of Health and Human Services from the state of Michigan have given these directives. So first and foremost, this is not applicable to only the home health services, but all the healthcare workers in the state of Michigan. We really have to notify the administrator or the clinical manager immediately about the exposure if we know that we are exposed to positive COVID-19 positive cases or persons. So the discipline, or for example, if you are the nurse, you have to self-quarantine yourself for 7 to 14 days if exposed. So, and you have to monitor and provide a list of patients that were seen in the past 14 days. So this is part of the contact tracing. And you have to, the administrator will provide information for number to obtain testing for COVID-19. So they will subject you for screening, and the administrator and the clinical manager will notify any clients, the family or the caregiver, and other disciplines that have come in contact with positive employee, and information will be provided to maximize precaution to limit further exposure. So this is just part of the prevention. And this is the newest guidelines. Okay, so this is the guidance for all providers and staff involved in patient care and public health staffing with critical roles in the COVID-19 response. This is more particular to us home health care personnels. So first and foremost, as we observe the CDC guidelines, these are just the additional protocols that we really have to observe. So we are asked, if you feel sick, we have to stay home. And second is, healthcare workers currently prohibited from working because of previous guidance. As you can remember before, if you feel sick, you have to quarantine yourself for 7 to 14 days. But this time, if you are asymptomatic, you can still go back to work. You can work as long as the facility's occupational health program will monitor you and you will monitor yourself. Why is that so? Because of the lack of healthcare workers. So if all the healthcare workers in a certain facility will be exposed, because most likely all of us might be exposed, and if all of us will be quarantined, so who will look after these patients? So nobody. So as long as you will observe the proper protocol, you will wear your PPEs, and but you really have to go back to work, if especially if you are asymptomatic, as long as you don't have fever and difficulty of breathing. So this is really being implemented strictly by the agencies. So all healthcare workers should monitor for fever with twice daily temperature measurements and for symptoms consistent with COVID-19. This is strictly implemented, I tell you, because you know what? Every day, every single day, We really have to take our temperature before we get out of the house, and in the afternoon when we get home. So we have to log it because we have to submit it to our employers. At the same time, um, when we are doing the visit, there's no problem if you will go directly to the patient's home. But for example, I have to do some visits in senior houses or uh, long-term facilities or assisted living facilities. The personnel there must take my temperature and I have to answer the survey. So I have to, there are questions there or survey whether I've been exposed or I've been traveling for 14 days, within 14 days, or if I have fever, cough, headache, and all the COVID-19 symptoms. So that's the protocol that we really have to abide every now and then. So, and then if you are a healthcare worker who has had a known high risk exposure to a patient with confirmed COVID-19, you should take extra care to monitor your health. But you have to keep working. There is no requirement already for now for 14-day quarantine of healthcare workers with high-risk exposures in the setting of sustained community transmission as we have in multiple areas of the state of Michigan. So here in Michigan, Detroit is the heavily been affected. But we cannot say no if our patient is living in Detroit. So and the last thing, the innovation, it's been existing. I heard it from the talk from Australia. And this is the telemedicine support during the COVID-19 pandemic. And it is being enhanced here. It is being used primarily because, you know what, during the February or March, or when we started the lockdown here in March, um, majority of the doctors clinics were closed, and until now some of them are still closed. And the common complaints that you will be getting from patients is that they are having really difficulty getting some appointments with the doctors. So they are really relying on the home health services, because without the home health services they will not be seen by anybody. They will not be taken care of. So the symptoms might not be, forwarded to the proper authorities, especially to the doctors.
Ma'am, you
So,
have 1 minute more.
okay, almost done.
Yeah.
So the telemedicine encompasses a set of tools. So this is based on the cdc.gov website. Also, they agreed to this, that this is a set of tools that leverage information and communication technologies to most commonly extend medical care across geographic distances and boundaries. So this is really very helpful because we also term this as a clinical distancing, wherein the doctor and the patient can really collaborate through online. Okay, so I have seen some of my patients doing this. They are doing this teleconferencing with the doctor, wherein they can, they can just tell what are the symptoms that they have. They can show the status of their stoma for that day, and they can share with them the results of the blood draw or the blood works that they have done for the patient. And by the way, also speaking of blood draw, uh, the 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 home health nurse here is also the one doing the blood draw for the patient being sent to laboratories, and then it will just be forwarded to the physician. And then telemedicine can be provided through primary mechanisms. This is just direct to patient, wherein the healthcare provider examines the patient in real time, or it can be teleconsultation using phones or audio. so they can just discuss the current conditions. So this is are just the references that I can share with you. And yeah, that's it. Thank you so much for your attention. And if you have some questions, just have my email.
Okay.
So
Yes. Thank you,
thank you
ma'am,
so
for
much
your
for the opportunity. Yeah.
yeah. Thank you very much for your fabulous presentation. Again, I would like also to ask you, because there are so many questions for you in the Q&A feature. The below button, you can see the feature Q&A. Because we cannot cover all the question, we kindly ask you to just respond the question on the Q&A feature. Thank you, ma'am.
Thank you. Thank you.
And yes, now we are going to the next speaker. Next, we will have Ibu Dr. Astuti Yuni Nursasi, SKP Master of Nursing. She is a lecturer in the Community and Family Nursing Department of the University of Indonesia, and right now she also works in University of Indonesia Hospital. She is active speakers and also author for family nursing care. And Ibu Yuni will talk about the implementation of family nursing care during the COVID pandemic, and which is more focused on the nursing care plans for the family during this crisis. So welcome Ibu Yuni for a 25 minutes presentation, and the floor is yours right now. Ibu Yuni? Ibu Yuni? Halo Ibu Yuni? Ibu masih unmute? I'm so sorry Ibu. You are still... Halo Ibu Yuni?
Sorry, I forget to unmute.
Oh yeah, thank you Ibu.
Sorry.
Yeah, Ibu, for a 20 minutes presentation for you, Ibu.
Yeah, thank you very much, Ibu Telly, and good day for all the speakers and all the participants. It's very nice to hear all the speakers' experience, yeah, especially for from outside Indonesia. It's very interesting lesson to learn for, especially for nurses in Indonesia. And for today topics, I was asked to talk about the implementation of family nursing. It's already share screen, Bu. Oh
Not
yeah,
yet, Ibu, not yet.
Yeah.
Yeah.
Oops, sorry. Okay.
Yeah.
Thank you. And yeah, okay. It's already share. Ibu Telly, is
Yeah,
clear?
we already see your presentation, Ibu.
Okay, we'll talk about the implementation of family nursing care during COVID-19 pandemic. And I think the implementation of family nursing is likely similar with Ibu Maria from Michigan experience is home care nursing. But in Michigan, of course, more advanced than Indonesia. Yeah, this is okay. Yeah, this is my curriculum vitae that I've been also come to the Flinders University. I don't know whether I have met Kristen or not last time, because I finished my study at 2000, at the year 2000. So I miss the Flinders now. Yeah, and I start my presentation with the general definition of the family, just a refreshment about sharing perception, what we think about the family. in from Bahasa Indonesia dictionary, family is a mother, is consists of mother, father, and children in the whole in the one whole house. And from Undang-Undang Nomor 52 tahun 2009 about population and family development, family is the smallest unit that consists from the society, that consisting of husband, wife, or husband, wife and children, or father and his children, or mother and her children. And the family become like a traditional family and non-traditional family. Uh, and from Ministry of Health of Indonesia, Republic Indonesia, we it said that family is institution which is the smallest unit of society, and it called a household or nuclear family. Yeah. Uh, Next, uh, I would like also to share about the family nursing process. Yeah, that we know that the unique assessment from the family nursing is because we have to do assessment not only at the family but also from individual family member. So of family, we assess social cultural, how they live with their social cultural, the environmental structure, the family structure, family function, uh, the stress, and how the family cope with the stress when we know as a coping strategies. And from family individual member, we usually assess the status of mental health, physical health, emotional, social, and spiritual. From the data that we got from assessment, we do identification of family and we determine the problem or the gap of need that the family need to be solved. And we uh, call it as a nursing diagnosis. Nursing diagnosis will become our guidance to uh, to achieve the family need to gain their health. After identification of family nursing diagnosis, we develop the nursing plan. The nursing plan consists of setting goals, identifying sources that can used by the family to solve their health problem, not only health but also social. And if we refer to pandemic, COVID-19 pandemic, social issue become more important in the family because of uh, what is there is a pembatasan, there is a not isolation but there is a like a lockdown or quarantine, so there is a limitation to go far from their home. The next is we also identify alternative approach, what kind of intervention that can we do for the family, also choosing nursing intervention that appropriate with the family resources and setting the nursing priorities. After we have a nursing plan, we do the intervention. That intervention we need have a categorized as direct intervention, health education. Maybe we already hear from Ibu Maria about kind of nursing intervention that she has done for her family in Michigan. Oh no, her patient in Michigan, Ibu Maria. And after all do the intervention, we do the nursing intervention, this evaluation. So all these process are included in the family nursing process. So what we uh, do for the family with COVID-19. Uh, Family with COVID-19, include as a vulnerable family. So what is a vulnerable family? Vulnerable family is a family has high risk in their health. They have multiple cumulative risks that commonly related to low health status and minimal access to healthcare. And the vulnerable family has a development problem, also low social status, unsupported personal and interpersonal. And what kind of vulnerability factors for the vulnerable family? There have limitation in physical, environmental, human, and psychological resources, economical factor, less social support, chronic illness, and stress. And Friedman has several characteristics for vulnerable family. Usually, vulnerable family deny any problem that they have faced, and there is exploitation to one or more family member. The second one is usually they use non-adaptive coping, loss or separation of family members, and there is a domination in a vulnerable family. How about the family with COVID-19? COVID-19, uh, with a family with a COVID-19, usually they are not necessary for hospitalization because some person only has a mild or none symptoms, so they will get well soon. So there is no necessary for hospitalization. There are risk factors are identified that will cause adverse effects such as age, for more than 40 years old are more vulnerable. For someone with the immunity system, low immunity system will also have a more risk than other person. And another risk factor are multiple chronic illness like cardiovascular disease, diabetic, chronic obstructive pulmonary disease, chronic renal disease, cancer, and etc. And male more susceptible than female, maybe because they have female also need to go from home to work, yeah, rather than female that usually is a housewife. And the length of infectious period is unknown, so there is no time frame that can be referral for a patient safety. This is a profile of pandemic COVID-19 in Indonesia. There are 4,400 person are confirmed, yeah, and 22,466 are in during caring, uh, and 19,703 are covered from the COVID-19, and unfortunately we still have 2,231 who get die from the COVID-19. And this one is COVID-19 in Indonesia. We see here there are 7 provinces that have high number. First of all are Jakarta, East Java, South Sulawesi, West Java, Central Java, South Kalimantan, and South Sulawesi. South Sumatra, I mean. And because Rumah Sakit Universitas Indonesia are in Depok, we also I am also concerned with the number here that are 666 patients are confirmed have COVID-19, and uh, there are a lot of number here, 2,076 are without symptoms. So this kind of person are no need to be hospitalized, but they become a source of contagious for people surrounding and the environment. So for us at Depok, we have to concern with this number. So what is the impact of COVID-19 to the family? If we do the assessment here, we know that COVID-19 makes some changes of the family. First of all, are changes on physical, physiological, and social health. For school age family member, they usually have time to play with their peers, but now they have to stay at home, listen to her fussy mother. There is more rule than before. Yeah, so become maybe become a psychological burden for school age family member here. And for the family member who get mild symptoms, maybe will get change on the physical. The second one is changes on healthy lifestyle. Maybe in the family there is no habit uh, to do the hand hygiene regularly. They didn't wash their hand properly, and now the health the way to wash their hand uh, should be in the six right what the six step right for the washing hand, and also the habit to use mask, wearing mask also become a new habit. The third one is changes on communication and interaction pattern. Uh, Mostly family in Indonesia, or especially in Depok and Jakarta, mother and father will go to work from 6 to 6 every day. So children will have time free to do what they want to do. But now, because there is a work from home uh, work from home what regulation, mostly mother will stay at home talking to the children, and maybe this mother also have a stressor because they their partner or their office partner, and also they don't have their me time, so the way of their communicate and their interaction become changed. uh, the next change is a coping and stress pattern. Also there is a change. And the last but not least, in healthcare function, usually when some uh, of the family member are confirmed positive have COVID-19, all the healthcare function will be changed. They have to take pay attention for preparing all the needs to do self-isolation for the family member who are confirmed positive. This one is the nursing roles in pandemic COVID-19. Uh, we have some roles like care provider, educator, motivator, counselor, and surveyor, as well as collaborator. As a frontliner during pandemic COVID, we have to be ready, do our role as a care provider. Nurses work at all settings under physical and psychological pressure because we work using a PPA, so quite hard for nurse who use the the hazmat, the mask, and wearing the face shield is quite difficult to breathe sometimes, as well as a stigma. Some this one is quite I mean, Indonesian nurses also face stigma from their environment or home environment or their neighbor. So some of them are asking to go from their house, and so our nurses just stay at the hospital or the puskesmas or public health nursing. The second role is become an educator. We need to provide information, and some gap here. Not all the healthcare setting are provided by good connection of internet, and not all the patient have a familiar with the internet. So to provide information, sometimes we have to come to the family house or to the community, their home, to give the education. It become some constraints that we as an Indonesian nurse face. The third one is a motivator. Nurses need to be a motivate, not to be a motivator for all patient and people surrounding her or him. Nurses are needed to giving support and motivation to patient and family. And as a counselor or surveyor, we need to provide protection during pandemic for patient and family to help education session and research. Some, for example, like this in conference, webinar conference, we share our research, our concern, gitu. But we didn't do it face to face. And collaborator also become our important role here, because we need to work hand in hand with uh, doctor, with pharmacists, as well as public health worker, that we need to give more raise awareness from the community about protection for the for their safety, by not having going to come to some meeting directly or face to face. And how the Indonesian nurses manage or work with the COVID-19 inpatient, we have some mechanism. We do the epidemiological survey. So a patient who do their PCR test need to fill a form of epidemiological investigation. So if the patient are confirmed positive, so they will, I mean, the community health, the public health nurse or health ministry authority will know and will come to the patient home and do the test for all the contact, the contact from the patient here. The second one is implementing healthy Indonesian through family approach program, and implementing self-isolation. And the family nursing implementation, we do as a part of Perkesmas program. Perkesmas is perawatan kesehatan masyarakat or public health nursing. And if in some area already have a good management of family health nursing, so they will have some base camp in the community. So the nurse just can contact what we call as a healthcare volunteer. So we call kader. So nurses can contact kader to have like a health information to share with the community about the importance of doing a routine of best healthy practice in their behavior. Sorry, I mean PSBH. Good practice in health. So the second one is healthy Indonesian program with family approach. In Indonesia, we do have an assessment part or program, and now we do the intervention. From in some area, the intervention already implemented, but in some province hasn't begun with the implementation. Uh, Now I will just
Ibu
like a
Yuni,
case here.
halo Ibu Yuni, you still have
Yeah.
5 minutes more, Ibu.
Oh yeah. Okay.
Yeah.
About the assessment with COVID-19 patient. This one is about family database, physical, psychological, and social health problem. Healthy lifestyle habit with family member, interaction and communication pattern, coping and adaptation pattern within family member, and healthcare function implementation. After this assessment, there are some nursing diagnoses that we can uh, develop from ineffective health management, ineffective health maintenance, ineffective protection, caregiver tension, until interrupted family process. It can be raised from the family with COVID-19. And I will show the example of care plan for the family with COVID-19. The goal is optimize family function and capability to manage health care problem, increase immunity, provide coaching and support to maintain families member health status. And the objective, we refer to 5 family tasks: understand the health problem, decide what will family do, daily health practices, environment modification, and access to health care. The second objective is mobilize resources in the community, receive health care as demand, and function optimal in maintain health life within family member. And this one for the first objective, from the nursing outcome, family knowledge about health problem and healthy behavior. For the diagnosis, ineffective family health management. And result, we we have we expected the family will have knowledge and healthy behavior. And the nursing intervention that we plan here is health education for healthy behavior and education session for health problem. The second objective are decided family plan. So family planning about family health can provider performance, and the result health status and behavior, family function to family care. And the intervention is how to increase family support, family involvement, family presence facilitation. And the object for the third objective is caring for sick family member, and the result physical, psychological, social, and spiritual of family member. And the intervention is caregiver support and prevention of transmission. And in the third objective, I give example here what nurse can do for the family to successful self isolation. The family support need to give support emotionally, appracial, instrumental, and informational. For the emotional support, we need to giving attention to health condition, giving motivation during self-isolation, listening and accompanying the family member. And for appraisal support, we need to involve the member who's sick here to have a decision making, listen to and have discussion, and no change in routine activity. For the informational support, we have to guarantee that a family get access to COVID-19 information, treatment, and self-isolation, develop communication network to close health care facility, receive many kind media and topic of health education, and validating receive information to healthcare facility. And the instrumental support, we provide a special room with good light and ventilation, provide PPE for family member, provide health food, and hospital visit accompany. And next is a nursing care plan for objective 4 is maintain home environment. Is the outcome is health promotion behavior, how the family understand and how do the health practices increase and maintain health with the intervention guiding home environment maintenance and risk identification. And the last objective is using healthcare facilities for family health and well-being with the intervention, family involvement promotion, and involve family development. I think it's all the presentation. I thank for your attention and good day.
Thank you, Ibu Yuni.
Yeah.
Ibu Yuni, thank you very much for your presentation. Ladies and gentlemen, speakers and online participants, please stay with us and participate with us because our last speaker for today will share about the COVID-19 and primary healthcare strategies in the Netherlands. Marian Oslan Haring, registered nurse, medical, Master of Science in Sociology from the University of Amsterdam. Right now, she is a lecturer in Via Hoge School of the Netherlands. She is also a coordinator for a minor transcultural nursing and nurse youth healthcare in Amsterdam. She will explore about the current situation of COVID-19 in the Netherlands, also the proactive care plans applied during this crisis in the country, and the tips for nurses during this COVID-19 pandemic. So Marianne, the floor is yours for a 25 minutes presentation.
Thank you very much, Margareta.
Yeah,
and thank you
welcome.
all. Selamat siang, I think that's the right word for good afternoon, everyone.
Excuse me, Ibu Yuni, could you please to stop slide share, Ibu Yuni? Stop
yeah,
slide share. Yeah, stay
yeah. Okay. Stop share.
Stop. Yeah. Thank you.
I think. Do you see the PowerPoint?
Yeah,
right
yeah, we already see your PowerPoint.
Okay.
But could you please to show the slides? So slides.
I don't. You don't see the slide right now?
Yeah, we already see, but
I don't know what I have to do now.
Okay, but it's okay. It's okay. You can.
It's okay. Yeah.
Yeah. Okay.
Okay. Well, thank you very much for this invitation, and I found it really interesting to hear all of your stories, and it's so nice to feel connected with all nurses around the whole world. So that's really nice. Well, my name is Marian Haring. I'm a teacher in nursing at the University in Zwolle, VIA, which is in the Netherlands. And today I would like to tell you something about COVID and nursing care in the Netherlands. I'm not in the front line. I coach nursing students of our school during their internships, for example. And I will start with a general talk about COVID and the Dutch policy in the Netherlands. And thereafter, I speak about the COVID crisis in the hospitals and community care and interventions, about anxiousness, taking care of healthcare professionals, and our best practices. It's just a small part of the reality, but I hope you have get a good view of the nursing care in the Netherlands. Do you see my next slide now?
Yeah.
Okay. Well, on Thursday, February, the first infection with the coronavirus was a fact. And since March, half March, the Netherlands has been in an intelligent lockdown. This means that people can still go outside, but schools and childcare, restaurants, cafes are closed, and people have to work at home. Last week, the schools and childcare start again. So it's really exciting what happens now in this time with the COVID crisis. On April 11, the curve hit its highest point with the new cases of corona. There are currently over 6,000 deadly victims, and this amounts 35 per 100,000 persons in the Netherlands. Fortunately, there has been no overload of the healthcare system. However, doctors and nurses and other support services have to make every effort. Special corona wards appeared in hospitals, and much regular care was stopped if possible. The RIVM, that is our National Institute for Public Health, has always informed the citizens about the number of infections. They also issue all kinds of guidelines that the citizens must adhere to. For example, keeping social distance of 1.5 meters is an important measure, and it has also a major impact on our society. Certainly in the beginning, there have been regular news broadcasts informing the citizens about the measures which are taken. Every day, an update is given of the number of new infections. And now from June 1, citizens have the opportunity to be tested for COVID-19. And that's maybe a little bit late, but now they have the opportunity. So if a person have one or more symptoms of COVID, a person must stay at home, get tested and recuperate. And if a person had fever or difficulty breathing, everyone in the household must stay at home. So that are the guidelines at this moment. The National Institute for Public Health has drawn up protocols for healthcare professionals. Initially, much attention was paid on the measures in the hospitals. In retrospect, too little attention has been paid to measures and policy in elderly homes and community care. And perhaps one of the most severe measures has been the visiting policy in elderly homes and other institutions. People who live in an institution were no longer allowed to receive visitors. This has a huge impact on the patients, and students of mine who worked in the elderly care said that people lost weight and developed depressive complaints because they get no visitors anymore. Well, we had a lot of challenges in our healthcare system to deal with the COVID patients. Hospital has made a great transformation. Patients were transferred to other hospitals which had more intensive care capacity. More intensive care places were also created. And there was a lack of PPE, especially in the elderly homes. Well, the corona departments were really different worlds because everyone wear personal protective equipment, but also because everything was new about this disease. An important point of attention in this was to be careful not being primarily a logistic process, but to keep humanity in mind. Because the clinical presentation of COVID is so erratic, clients can deteriorate enormously in half an hour. The patient does not really feel how sick he or she is, and that is also difficult for the family too. It's, for example, difficult to be on time to say goodbye. In this period, much has been developed. So training for nurses has been made available. Some organization made e-learnings about isolation nursing, dyspnea, and other themes that are discussed at COVID-19. And for example, also a pocket card about the clinical presentation has been designed because many healthcare workers from other departments were deployed, and it's useful to share the knowledge about the disease immediately. And outside the hospital, a special team of nurses has been set up to care for corona patients in their homes. These teams worked from a hotel where they were driven to the corona patients by taxi drivers. Now we know much more about the impact of the coronavirus on people. And professionals have seen that not every patient is able to receive treatment on the intensive care. COVID-19 is an incurable disease. Not the doctor, but the body heals the sick person. So the hospital can support, but not cure. In the hospitals are researchers such as oxygen, medication, and if a patient is fit enough, he or she can be treated on the intensive care. But other resources are being cut. So there is no longer any support from home, contact with their loved ones. Therefore, proactive care planning is necessary. Clients are encouraged to already discuss healthcare possibilities with their GPs and their loved ones in case someone gets sick from COVID. Well, as a nurse, it's very important to have a holistic view on the client and his or her environment. Psychological well-being is very important and also an aspect that COVID has a lot of influence on. In the hospitals, there are mental support teams for the family and the patients. But it's very difficult that the patient does not feel how sick he or she is. Patients report that they cannot imagine that they are dying, or patient ask if the oxygen gap can be taken off. And this clinical presentation generates unrest by the patient and also by their families. Patients with COVID experience fear because of the intense situation they have ended up. And anxious patients have a harder time to listen. It takes time for the patient. That's very important. Questions who are important to ask are: do you feel feel tense of anxiousness? Do you have fears? Are you concerned? How can I support you? And also, not being allowed to receive visitors has also a huge impact of the feelings of fear. So it can also increase feelings of fear. Well, nurses and other care providers are often unrecognizable due to protection measures. And also that can increase feelings of fear. Certainly during the hectic period, many health professionals work on a department, and it's a good idea to make healthcare workers recognizable. So this can be done, for example, by placing a name sticker or even a photo of the healthcare worker on the chest. This is also useful for the healthcare workers themselves. Everyone looks the same with the PPE equipment. By using name or stickers or even photos, you can easily recognize each other. Also, notepads and cuddly bears for people who feel lonely were used. First, people laugh about the cuddle bears, but they found out it really works for people who have feelings of fear. Also, the nurses work in pairs, so there's a greater chance of personal contact with the clients and also to express the client's wishes. At the intensive care, it was much more difficult to find out as a nurse who your patient is and to have that holistic perspective on your clients. Normally, the intensive care nurses gets to know the patient through the family. In a hospital, family members have been asked to make a poster or a collage about the patient so that care providers can also get to know the patients. On that poster, the nurse can find, for example, someone's music taste, hobbies, and other characteristics. Also, a diary for the family is kept. Healthcare workers use Skype a lot because it's very important for the family to see what it looks like on the intensive care and also to see their loved ones. Community nurses find neglected patients in their homes more often than before. And this is because people have no longer their daily activities because of the lockdown, receive hardly any visitors and receive less attention. And because the informal care is also less available, the nurse's role in this is more important. So the loneliness, anxious, and COVID-19's erratic behavior make the work of a nurse extra stressful. A Dutch professional association of nurses has recently conducted research into the experience of nurses, and they found out that 96% of the nurses who were survived experienced more psychological stress since the corona crisis. Fatigue, insecurity, stress, powerlessness, restlessness, sleeplessness, and anxiety were the most common complaints. Especially in the hectic periods and even now, it's very important also to take good care of the healthcare professionals in the hospitals and in other healthcare institutions. Caring for each other is extremely important. Have to pay attention for each other. A health professional must have enough time to relax between the shifts. In the Jeroen Bos Hospital, that's a hospital in the epicenter of the virus outbreak, for example, they pay extra attention for nutrition. Time for lunch is limited. It's difficult for nurses who deal with isolation care to consume 3 good feedings a day. Together with the supermarket, there's a pick-up point where nurses can buy a bag of groceries in the hospital. Because in the supermarket, maybe you have also the same experience. When in the afternoon there were no products available anymore. So this is very helpful for nurses. Also, fruit has made available in the hospitals. And isolated nursing is physically difficult for nurses because of the heat, and cooling vest and slush puppies, ice drinks, were offered to cool down before, during, and after the shift. And also peer support has been set up in institutions. This peer support is a system in which healthcare professionals proactively receive each other. There's no waiting for requests for help, but help is offered immediately after a serious situation. And this is also something that's now being developed online. So nurses can share their story in an environment where interaction is possible. And this can also be done anonymously. Okay, where do we go from here? The number of corona patients in hospitals is decreasing now, and also care is resumed step by step. But the threat of a second wave is still present. So the primary schools are open and more measures become more relaxed. So we have to find out what happened in our society. Well, the recordings of corona patients have brought more attention to how drastic intensive care can be for body and mind. For corona patients, the struggle only starts after the intensive care. Most have serious complaints for years. It is estimated approximately 80% of corona patients who are on a ventilator or breathing machine will soon have post-intensive care syndrome. At this time, the Netherlands does not yet have a system that can provide aftercare for these people. But there are some nurses who work on it, and they said the effects of the post-intensive care syndrome can be reduced by recognizing the symptoms as early as possible, and furthermore, sedate as little as possible, mobilize the patient as quickly as possible, maintain a true day and night rhythm, and ensure healthy nutrition. and also keep a diary for patients during their intensive care admission can help to cope with the process. Well, although that society has generally adhered well to the measures drawn up by the government, there is also an increasing resistance from citizens against these measures. We hope that we will not have a new wave of corona infections. A lot investigation is necessary because the pandemic is far from over worldwide. I wish everyone a lot of strength. Let's stay strong together. And now I have come to the end of my presentation. I will thank you very much for your attention. Terima kasih. That's the Indonesian word,
Yeah.
I think. Okay, thank you very much.
Yes. Thank you very much, Marian, for your fabulous presentation also. And also, I would like to say thank you very much for all participants who are still with us until now. And now we are going to the discussion session. We have already several questions for all of you. And let's start with the questions for Kristen. Kristen? Yeah. Of course, there are so many questions for you, Kristen, but we only pick some of the questions. Yeah.
No problem. I've answered 20, like quite a few now, I think. So hopefully people have been able to see some of the answers that I've put up, and I've also put some links into some of them.
Okay, thank you.
Online.
Katian, yeah, could you please share the questions for Kristen? Hello. Hello. Yeah. We start with the question for Kristen. Okay. Yeah. Kristen, there are 4 questions for you. You can see on this slide.
Mm-hmm. Sure. For the first one, every year Australians are really encouraged to get the influenza vaccine because the flu itself actually does have some significant ramifications, especially for vulnerable people. Here in Australia, we have quite an elderly population, and so older people are really encouraged to get the flu vaccine because we do have people who become hospitalised or in intensive care and die from the flu here in Australia as well. And so at a time where we have elderly people who are vulnerable from COVID-19, you're not wanting them to be impacted by flu, which then will decrease their immune system and their ability to recover from COVID-19 if they actually become infected with that. And so that's a really important thing. Here we have the flu shot is available in our immunisation program. And health workers are certainly encouraged to get it, the elderly, children. It is something that we have every year, and it has been really pushed this year as well in this pandemic. So it really is to prevent the issues from the flu itself, but also in this COVID-19 area is really important as well. In terms of the next question, okay, so the World Health Organization and certainly in Australia, we are still encouraging breastfeeding, and there's no research to show that COVID-19 is transmitted through breast milk. However, women are at risk of, if they do have COVID-19, of transmitting that to their baby if they were to cough on them, or if they were to have their hands with the virus on it and then touch the baby's face. So we are still encouraging breastfeeding, but certainly we are asking women to be really careful in terms of their hygiene, washing their hands, not coughing on their children whilst they're breastfeeding, and potentially using masks in that area to prevent transmission of COVID-19 to their baby. We don't have many babies, I believe, who have had COVID-19 here. But certainly we are being very, very mindful to be careful around neonates. One of the things with our special care nursery here is we didn't have any students being able to go into that area to protect them, and to make sure that they were being, kept as far away from anybody who might be able to infect them, because babies in special care nursery or neonatal intensive care are higher risk. So there have been very stringent guidelines with that. In terms of telehealth instead of telemedicine,
Telemedicine.
yeah, no, that's a really good point. And telemedicine is a very commonly used term. I think when we in Australia, and I'm not sure if in other countries if they use the word telehealth as well, but telemedicine has often been here in Australia used for medical doctors, but we have other health professionals who are using the same sort of systems who are not doctors. And so, for instance, as nurses or midwives, we, like midwives especially, we come from a health focus, and so using the term medicine rather than health is something that we want to try and keep away from. So in terms of using telehealth, there are lots of different systems in place. Sometimes a lot of midwives will actually maybe use Skype, maybe use Zoom or other things that are available. They have actually other systems, conference systems that are set up. And a lot of the time they'll just get on the telephone and either FaceTime or have a chat over the phone with somebody, especially if it is a longer discussion that they're having. So there is a really large scope for using telehealth. And as I was saying before, in Australia, we have a lot of rural and remote women and families. We've got people who are out on cattle stations who are 500 kilometres away from their neighbour. So there's lots of systems that are being put in place. We do need to get a better NBN internet system in Australia. We're a little bit behind in regards to that, but certainly there's a lot of scope to use that and use it really well. In terms of the Zanao, oops, I can't quite see the picture. I've sent there a specific link about the drug regime, because there have been a whole bunch of things that have come out about what medications can be used to treat COVID-19. The latest one that I replied to somebody else about was the use of dexamethasone. There's been a trial that's come out to look at the anti-inflammatory properties of that in reducing the amount of people who need to be intubated and have respiratory support. That's just literally come out, and that certainly hasn't been approved by the government yet. So I've actually sent a link to and I can put it on the main chat room about the government's response to that study, that it looks exciting and it's a possibility, but it's not been approved. So there's the majority of people who are admitted into hospital would actually be symptomatically treated. And so we're not using a lot of the drugs necessarily that have been out there, that, there's no standard treatment that's been approved, because there's still lots of research happening and nothing's been proven as being the thing that is the treatment for COVID-19. So watch that space. There's lots of research happening. And I don't know if anybody else from whether Maria or Marianne has something that's come out in their respective country. But it's a tricky one. And I'll put that link. There actually is a website on the Australian government about what drugs have been thought of and may be being trialled, but aren't actually the standard gold standard of this is what we would use, and it's a quick fix. There's nothing available that's going to go into be the magical treatment.
Okay.
Yeah, I think. Oh, one thing, just there was a question I think related to that, is there a standard treatment from national level? The Australian government, they will, if something comes up, they probably will send out a recommendation, but each state has their own health department that then comes up with their own guidelines that link back into the national government and health department. And so the hospitals will usually have guidelines that are sent out to them and developed in line with their state Department of Health.
Okay, thank you, Kristen, for your response to the questions. Now we are going to the question for Maria. Would you please to show the questions for Maria?
Yes.
Hello, yeah. Or not Ibu Astuti or Dr. Maria first? Yeah. No, no, no. This is it, Marian. No. Yeah, yeah. This one. Yes. Thank you. There are 4 questions for you.
Okay, so for the first question, what are the barriers? I think primarily one of the barriers is the fear. Okay, so because home health nurses or uh, professionals might, we felt worried also of going to patients' houses or homes or facilities because we are afraid that we might uh, acquire the COVID-19 virus as well. So, and then at the same time is if the patients or if the family are not open to health teachings or education pertaining to COVID-19 protocols. That's also a barrier. And another thing is if there is a communication barrier per se, if there is a language barrier wherein the family or the patient cannot really understand uh, what's really going on. Especially, I had a question there if, especially if the patient is demented or has Alzheimer's. So, how can we do the health teachings to them? So, basic, very basic information that we give them is we hand them face mask. We ask them to do hand washing. Of course, it's very difficult for them to really understand what's it's all about COVID, but the basic thing that they really have to put mask whenever they go out or whenever there are people around them is already a big deal for us. And then second, what do you think of the view that home care will increase the risk of COVID transmission through health workers? Yeah, we are also considering that. That's why it is really very important that first and foremost, the home care personnel must be educated well on how to, on how to decrease or minimize the mode of transmission. So the proper use of PPEs and the strict implementation of the protocols and guidelines when you are going to patients' bedside or to their homes is really very crucial. Um, there might really be an increased risk if a certain nurse or a certain therapist will not really follow the protocols. But as long as everybody's following the protocols, but because what we do here is before we proceed to patient's house, we try to browse the referrals and we check the status or the screening or the result of the COVID test, or we try to do the survey on phone. We ask several questions whether they have the symptoms, whether they travel or not, whether they were in contact with the COVID positive patients or not. So we do those initial screening even before going to patients' houses. And then next is how to handle the psychology of the people in pandemic COVID-19 because they feel scary and worry also fear. How about the government's action with this situation? Mm, about the psycho because really the anxiety disorders, um, the depression really increase during this time of pandemic. So this is not only limited to those people who acquire the disease, but also to it extends to their families and to everyone. So mental health is being implemented as well, and it's also again part of the education, the health teaching to these people because sometimes their worries, their anxiety is present because of they don't know something about the COVID-19. But if they will be educated well on how to protect themselves and how to protect others as well, so we try to lessen those anxiety. And then what's allow me to ask a question. In your activities community, have you ever feel afraid? Yes. um yes. Especially during the first few days. And honestly, I want to tell you, when the governor of the state of Michigan issued or mandated or implemented the lockdown, uh, I felt so afraid. I felt so worried, and I did not report to work I filed a leave of absence for almost a week because of that fear. Because I'm afraid for myself, I'm afraid for my children, and I'm afraid for, you know, I have these patients who are already 99 years old, and most of them are on their 90s. You know what I'm afraid of is I might be a courier and I might transfer to them the virus. And that's my fear because I don't want to compromise the health of my patients. They reach 99, they reach 98, and then all of a sudden, Maria will just go in there and then give them the worst, the nightmare. So that's my fear initially, but later on I was able to conquer that. I was able to, I read a lot about COVID. Of course, this is new to all of us, so we really have to empower also ourselves and to be educated as well, uh, on how we can prevent the spread of the virus.
Okay, thank you, ma'am, for your
Thank you so
clear
much.
explanation. Now we are going to the question for Ibu Yuni. Please, modest, could you please to show the questions for Ibu Yuni? Yeah, this is the questions for you, Ibu Yuni. There are 3 questions.
Yeah, my question is about the limit of the role of family nurse in providing nursing care to positive patient at home. Actually, if the family member are confirmed positive and they are not hospitalized, it means that this patient doesn't health symptoms or COVID-19 symptoms. So the the nursing intervention will focus on providing information about how to do the self isolation properly and successfully. So first of all, the need to give information about what is what the family should know about the self isolation. What will be happen if the family member doesn't want to be self isolation? What kind of environment or what kind of room are needed? Room is needed with for the family member who confirm positive, and how uh, the roles of the another family member to providing health needs for the family member who confirm positive. And so I think there will no limits for the family nurse doing their role. Just call them by phone, yeah, or ask the healthcare volunteer or a cadre to come to their house with we equip the cadre with the health education leaflet, yeah, or booklet, so the cadre can read the booklet. And if the patient or the family have a handphone, we can do what video conference or video call with the handphone. So the patient or the family can talk directly to the nurse. And the second one, what are the indicators for terminating family nursing care for COVID-19 at home? The indicators, of course, the result of PCR or swab. Usually, if the results are negative for the second time, it means that the patient is not be a carrier. But I mean, it's already safe, not I mean already self not to do the self isolation. So the indicator is the result of the swab test or PCR test. What is the example of the application of family nursing care done at the UI hospital? Okay, especially for family nursing care, we just we only focus at the level 1 family nursing care, which is focused on individual uh, individual family member. So we give we do assessment and intervention focus on the need of a family member. But next time, yeah, because Rumah Sakit Universitas Indonesia is a new hospital, so we are develop community health care. But from this year, we haven't have a good uh, collaboration with other community health center. So we still focus on the first level of family nursing care. So we haven't done the home visit, but we have a home care service. It's slightly different between family nursing care and home care service. Rumah Sakit UI Hospital have a home care, have a home 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 care services, but we haven't developed family nursing services. Maybe it's enough, Ibu
Okay.
Teli.
Yeah, thank you, Ibu Yuni, for your clear explanation. Now we are going to the questions for Marian. The questions for Marian. Ibu Modest, could you please to show the questions for Marian? Yeah, I'm sorry, Marian. Maybe because of the connection, cannot. But I will read the question for you. The first question is, uh, in the in line of your experience in Netherlands, how do you manage the students for clinical practice while all of us have to work from home?
Mhm.
Yeah, maybe just about your experience, how to deal with these students' activity in your
Yes.
school. Yeah.
Yes. Well, our students who have an internship, so they're clinical practical, they still do that in the hospitals and elderly homes, but they cannot go to school or other activities. So most students can continue their practice, and they are supervised by a nurse on the ward. And as a teacher, I keep contact digital. So also the assignments, we do it digital.
Yeah.
I hope is that an answer to the
Yeah,
question?
I think. And the second question, you see on the screen, you already see on the screen. What are the
Yes.
conditions?
Yeah. That's what are the conditions of work safely for nurses in the Netherlands? Are many nurses exposed to corona infections at work? And what is the government policy regarding this matter? Well, I think this is something that is really a discussion in the Netherlands, because there were not enough tests available in the beginning. So nurses in hospitals can get a test when they feel ill, but not in the elderly home. So that was a problem. But at this moment, for all nurses are tests available. So if people get ill, they can test themselves. I don't know how many nurses were infected at work. I have no numbers of that. And I think the government is working on it. They write policy for, they started writing policy for nurses in hospitals, and now also for nurses in elderly homes and other institutions. And then I will answer the third question.
Yeah, the third question. What are the conditions? Yeah.
Yeah, that's what are the conditions of home care in the Netherlands related to restrictions on home visits? Do nurses still make home visits? Yes, nurses make still the home visits. Normally, and that is for our student more difficult, because one nurse can visit the patient. So when our students want to come with a nurse, that was not possible. So students who work in the community care, they have to stop their clinical part. But nurses do still visit patients, and there are also protocols available for what if a patient is ill, what kind of PPE does a nurse need. So the government make all that kind of protocols for the nurses. So I think in the care, and now I see it become more normal. So people are not that afraid anymore to get ill, but they have to still be aware that it can happen, of course. But it's more relaxed now than it was before. Yeah.
Thank you, Marian. And now we are going to the questions for Pak Lon. Questions for Pak Lon. Pak Lon, if you already have the question, just continue to answer the questions. We are not going to wait for the slide. If you already have, just please answer the question. Yeah.
Okay. Thank you so much for the question. I try to answer the first question. I think the main thing we have to remember is community empowerment. In the era of COVID, we have to work together. PHC also have their limitation, and the most important thing to strengthen them is to stop the spreading of the disease. We as the community have to adhere with the COVID-19 protocol. Thus, we could have the medical workers not only in the PHC but also in hospital. And the second question, for the second question, we could not be tired to give health education. I think we could not be tired to give health education. Every time, everywhere, we give education for the people. And the third question, uh, I think we have to modify something to have running water, like what we do in Kupang and some area. We use the modified container so we could have running water. I think enough, Ibu Moderator.
Yes, thank you, Pak Lon. And again, I would like to say thank you very much for all of your clear explanation, also deep discussion. Of course, we draw so many take-home messages, especially excellent strategies to maintain the public health services during this COVID-19 pandemic. Before I close, I would like to highlight the key message from your presentation. First of all, we have to strengthen the primary health care as the core of the effort to achieve strong and sustainable health system. The second one is COVID-19 crisis and the realization of it, including individuals, communities are the key in the control of its spread. And also, this is like a reminder for us that primary health care is very basic needs for all of us today to combat the COVID-19 pandemic. And also the third one is consistent public health messaging and continuing essential services during this crisis, such as routine immunization to provide disease protection. Four is we have to keep ongoing physical distancing, travel restriction, also enhance the personal hygiene and PPA, personal protection equipments. And number five is vulnerable groups should be prioritized, such as children, pregnant women, and also the elderly people. The sixth is infection prevention and control precaution for staff and also the vulnerable groups. The eighth, develop clear protocols and guidelines for health emergencies for the future health challenges. I think this is very important. We have to be more prepared for the health emergencies in the future. Number eight, we have to innovation health services provision like telehealth or also telemedicine that already well applied in the USA, also in Australia, also in Netherlands. And for the virtual care consultation, mental health care, and local lactation support. Number nine is improve communication, also collaboration between all agencies. Now we are coming to a new situation that we are not going to solve the health problems but by ourselves, but we have to work in together with other agencies, both the government, also the non-government organization. And the last one is we have to conduct research in order to lead the government to make the excellent or good policy based on the problems or data from the community. That's all I think. And before I close, I will give you 2 minutes for each of you to give your closing statement, starting from you, Kristen. Kristen, are you still there? Kristen, closing statement for 2 minutes, Kristen.
Sure, surely. Look, I just would encourage everybody to stay safe and to really be able to provide any of your experiences or your concerns with your leaders, with your health directors, ministries of health, etc. Because being on the front line, as many of you are, or those of you working in education, the information that you can provide to be able to inform guidelines, to inform processes and policies moving forward is so essential. Often decisions are made at such high levels, but unless they're getting information from the front line of people who are really experiencing the impact of COVID-19 and are able to convey the impact on health service provision, on health workers, on our beneficiaries, those policies might not actually be written in a way that's going to be beneficial. So make sure that you have a voice, and nurses and midwives really have a great capacity and a great knowledge and experience to be able to be a really, really important voice in those decisions. So stay safe, everybody, and it's been an absolute pleasure to hear so many experiences and stories and to have some great questions asked. So really a pleasure. Thank you.
Thank you, Kristen. Now, Dr. Maria.
Yeah, hi.
Your closing statement, yeah.
Yes, first of all, I would like to thank everyone, especially the organizers for this opportunity to share with you the perspective of a frontliner who's fighting for COVID. So every day is really a challenge. So for the community nurses out there, I'm still encouraging you to, we have to face this. This is the reality, and we really have to embrace the new normal. And the only thing that we can really have to do is educate ourselves continuously as nurses, and we really have to keep safe and keep our patients safe as well. Thank you so much.
Thank you. Now, Marian. Marian, are you there? Oh, yeah. Marian, your closing statements?
Well, I think it was really nice and inspiring to listen to all of you and to be all together as a nurse. I think we can do a lot and keep courage, use and share your knowledge, and let's stay strong together.
Thank you. Now, Ibu Yuni, your closing statement.
Yeah, yeah. First of all, I'd like to thank to the committee, yeah, for inviting me as a speaker, and this seminar give me a new strength, yeah, to give me a motivation and a new new spirit, and for all nurses in Indonesia and all the world. Safety first for yourself and your family. Always be care for other and especially for the patient. And don't forget to keep in touch with all our friends in Indonesia and all the world, because if we do everything only with ourselves, we will become weak. But if we do together, we become strong. Nurses should have a strong voice and coordination. Thank you.
Thank you, Ibu Yuni. Now, Pak Lon, your closing statement.
Okay. Thank you very much, Ibu Teli. Thank you very much for all of amazing speakers and all of participants. According to me, uh, health workers in PHC are now being the first line of defense against COVID-19. They need support from others. They also need competent human resources, infrastructure, communication, commitment, and clarity regulation and fund. The most important thing is they need support from community too. I wish that my word will be used for all of us, especially colleagues who work in primary healthcare. Thank you, Ibu Teli.
Thank you, Pak Lon. And I would like to say thank you very much. This is the end of our webinar. As the moderator and on behalf of Health Polytechnic Kupang, I would like again to express again our appreciation for Pak Lon, Kristen, Ibu Maria, Ibu Yuni, and also Marian for your excellent presentation, and also all take-home messages for all of us today. I strongly believe that this information will encourage us to provide better health services for individual, for family, and also for communities. So, and also I would like to say thank you very much for all of participants who are still with us. Thank you for your attention and also for your patience. And again, thank you very much. Back to you, Ibu Wifi.
Okay. Thank you so much, Mrs. Telly, for being a great moderator this afternoon. And thank you for your amazing speakers, for our amazing speakers, for giving out all of us very informative and interesting presentation. Ladies and gentlemen, I would like to remind all of you to fill the evaluation form on the link that's on your screen, and also already share on YouTube and Zoom. Okay, before we going to the end of the webinar, I would like to please the Director of Health Polytechnic Kupang for giving the closing remarks. Dr. RH Christina SKM MKes, the time is yours. Halo, Ibu Dr. Christina.
Yeah, hello.
Please, the time is yours.
Okay, thank you. Ya, Assalamualaikum warahmatullahi wabarakatuh. Salam. Om Swastiastu, Namo Buddhaya, salam kebajikan. Yeah. Hello everybody, good afternoon. It is great to know that you all still stay tuned to this webinar until now. I hope all of you enjoy and get the benefit from this webinar. Every journey has its end and every path does stop somewhere. Now we come to closing ceremony. Before we close the webinar this afternoon, I, as the director of the Kupang Health Ministry of Health Polytechnic, would like to express my highest appreciation and gratitude to all the speakers. The one, Dr. Astuti Yuni Nursasi, SKP MN. Thank you so much. To Dr. Kristen Graham, Flinders University, Australia. Thank you so much. Dr. Maria Teresa Tovilo Soriano from USA. Thank you. Marian Oslan Haring, MSc dari from the Netherlands. Thank you. And Dr. Florentianus Stad from Polytechnic Kupang from Indonesia. Thank you so much for providing time and sharing knowledge to all of us. And also for all the participants, all international webinar. Thank you for making time and participating in this webinar. And also Nursing School of Health Polytechnic, especially the webinar committee, for make an effort to organize this webinar. I hope the knowledge and information obtained from today's webinar could be useful for all of us, especially for colleagues who work in primary healthcare. I hope that the information received from several countries about the implementation of handling of COVID-19 in the primary healthcare in their place could be a new input or a new strategy for us in dealing with COVID-19 in our respective places. See you on the next webinar. Stay safe and keep healthy. Thank you.
Thank you, Ibu.
Thank you, Ibu Dr. Christina. Okay, ladies and gentlemen, finally we come to the end of the event today. I reminding all of you to fill up the evaluation form because the certificate will only given to those who are filling the evaluation form link. Finally, we extend our deepest gratitude to all speakers who have been willing to taking time and share the knowledge and experience for all of us. And also to all participants from all over Indonesia and abroad who have participated in the entire webinar even from beginning until the end. We inform you the certificate will be sent to your email. We are now in the end of the webinar. I hope you have a great time with us and hoping that today's webinar presentation make an informative and useful talk for all of you. Thank you for spending time with us today. God bless.
Thank you. Kristen, thank you. Marian, thank you. Ibu Yuni, thank you.
Thank you.
Dr.
Thank you.
Maria, thank you
Thank
very much.
you, Kristen.
Thank you, everybody. That was a great
Thank you,
webinar.
Kristen.
Thank you, Maria.
Pleasure. Lovely to
Thank
see you
you.
all.
See you in the next
Ada video.
next occasion.
Absolutely.
Hopefully we meet again in Indonesia, Kristen.
When? Oh, let the plan come back.
For Mariam
Have
too.
plans to yeah. Welcome to
2020, 2021. Next
Okay.
year, I hope to be in Indonesia because the ICM, International Confederation of Midwives Conference is in.
Yeah.
I'll see if I can come and visit.
Okay, yeah. Thank you, Kristen.
Thank you so much for inviting me, guys.
Yeah, thank you.
Maria,
Thank you, Ibu Maria, thank you.
Thank you, Bu Maria Teresa.
Maria, thank you.
Thank you.
Astuti.
Thank
you.
Give our regards to Adam and Jael.
Ah, I will do that. Thank you.
Thank you, Marian.